Okay. So, sonoanatomy of peripheral nerves. So, first I am talking about the nerves which are of concern around the hip. So, you can see that the major nerves which are coming at the hip region. In the front side, there are two nerves. One is femoral nerve, and medial side it is obturator nerve, and posteriorly it is the sciatic nerve. So you can see these nerves are formed from the lumbosacral plexuses, lumbar plexus and sacral plexus. Sciatic nerve is, of course, having both the contribution. It is there from the both the lumbar plexus also has its contribution, and sacral plexus also has its contribution. Sciatic nerve, though it from the beginning only, both the fibers are actually separate, but together we call them as sciatic nerve. So for sciatic nerve block, we use in different different blocks as such. I will say that it is not a chronic pain procedure as such, but then we may need to go for, we should know that where is the sciatic nerve. At least during our chronic pain procedure, we should not be damaging this nerve. So from anterior side, it is the femoral nerve and obturator nerve. Obturator nerve is mainly, it is the uh, your medial side. All the adductor muscles are supplied by obturator nerves, but then femoral nerve, it is coming in the front. So we will see all these three nerves. Here you can see that if we see the femoral nerve, that where is that femoral nerve? So here a simple, it is at the groin level. At the groin level, I am seeing at the short axis view. This is the short axis view over the neurovascular bundle at the groin level. So this side, this right side of your screen, this is the medial side, and this side is lateral side. So here you see there is a neurovascular bundle. We can say that orientation from medial to lateral, this is VAN, vein. So this is first is femoral vein, then artery, then it is the nerve. It is the nerve. A very nice way to find the femoral nerve in this area by tracing the iliopsoas muscle. It is just at the margin of the iliopsoas muscle. The same technique is actually used at another place in ultrasound. That is the searching of peroneal nerve when we go for in the thigh muscle. Actually, we search the peroneal nerve just at the margin of the biceps femoris muscle. Okay, so this is the same way. So this is the iliopsoas muscle. Okay, this is the iliopsoas muscle. You can see this round margin is hip, hip bone, head of femur. Okay, and this is the cartilage. This is the cartilage above the head of femur. Okay, and this is the iliopsoas, mainly iliacus muscle. This is mainly iliacus muscle. Psoas has become tendinous here. Psoas has become tendinous. So this is the femoral nerve. Here, small nerves, I am not describing in a basic course. There are multiple small nerves here. We can find it in a genitofemoral nerve, lateral femoral cutaneous nerve. So there are different nerves are there around the hip, but main is femoral nerve. This now I'm going to show you the sciatic nerve. So you see this sciatic nerve is actually what we are seeing here. We are seeing this is the femur upper end just below the just below the trochanters, greater trochanter level, and below that. So there it is the short axis view of the femur. Here we can see that below the adductor group of muscles, this is the sciatic nerve, adductor magnus muscle. So here it is basically longus brevis magnus. So all adductor compartment we will see in the medial, and then below the adductor magnus muscle, we will see the sciatic nerve. So this is an anterior approach. This is the anterior approach to locate the sciatic nerve. But this approach, every time we will see in every patient, it is not like that, because patient's thigh, how much depth it is, that is also very important. If it is a thin patient, then only you will be able to see. If it is a very big thigh and this depth is too much, more than 10 centimeter, then it is difficult to differentiate this nerve. But you should know that where is the location. So location is the below the adductor group of muscles. Okay. Then comes posterior approach. So posterior approach of sciatic nerve. Here, two things we have to see. One is femur in the laterally, and another is ischemic ischial tuberosity, and femur. Okay. So below that, we will be able to see this sciatic nerve here. Here there is one muscle, that is quadriceps femoris. Just a minute, huh? Okay. So this sciatic nerve is at the in the posterior side. This is also a short axis. This is just below the gluteal crease, just below the gluteal crease. If I hold the probe in a short axis manner, and this probe you can see this is a curvilinear probe. So here also depth matters. Up to a certain depth you can see. After that it becomes hazy. But then here of course you can see by curvilinear probe. So this side is femur. This is the greater trochanter side. So this is lateral side. This left side is lateral side. And ischial tuberosity, this is the margin ischial tuberosity. So this is the medial side. So here we will be seeing both these two bony structures first. And then we will have there two group of muscles, two layer of muscles. One is gluteus maximus and one is quadriceps femoris. So not quadriceps femoris. Quadriceps femoris. Yeah. So between these two groups of muscles, it is the sciatic nerve we will be able to see. So, okay, then comes nerves around the knee. So, around the hip, we have understood that we will see mainly the femoral nerve in the front side. Medially, this is the obturator nerve, and posteriorly, this is the sciatic nerve. But sciatic nerve has uh, both the approaches, anterior approach or posterior approach. Nerves around the knee. So these nerves only coming down around the knee. So sciatic nerve again around the knee when it comes. So this yellow one, you see the sciatic nerve. Okay. So here I'm seeing that one branch, branching is actually, it is a bit above the this knee crease, or in this area you will be able to see a gap of a loose areolar tissue. In if you palpate, you will find a triangular area which is filled with loose areolar tissue. So you can see that this side is actually lateral side, because one branch is going in this way. So this is actually the common peroneal nerve branch, and this nerve is the tibial nerve. This is the tibial nerve, which is the common peroneal nerve, and both these branches are coming from the sciatic nerve. But this sciatic nerve branching is quite proximal. It is more than 6 centimeter proximal from the crease of the this one crease of the knee, posterior crease of the knee. It is quite proximal. And then when it comes this area, when you go a bit proximally, you will see that sciatic nerve is a bit deep there. But when it comes again in the after division, when it goes down, you will gradually see the common peroneal nerve, which is going just at the margin of the biceps femoris muscle, just at the biceps femoris muscle, and it is going down around the neck of the fibula. And tibial nerve, of course, you can trace up to some length. After that, it goes deep. So these two nerves we can see from posterior side. Then comes Syphilis nerve. So Syphilis nerve is also this is continuation of femoral nerve only. This is continuation of femoral nerve, and we find it in the adductor canal. Adductor canal. You just nicely see that there are three compartments. If we cut, we take a axis, this one axial section. If we take a axial section at the mid thigh level, then there are three groups of muscles. One is anterior group of muscle. One is posterior group of muscle, muscle, and one is medial group of muscle. These medial group of muscles are actually comes from the gradually when comes down, we come from knee to ankle area. Then they are actually when we come down, then it becomes in the medial side, but otherwise they are the deep muscles of the posterior compartment. So here you can see that the uppermost muscle is sartorius. So this is around from the knee joint line, if 6 to 7 centimeters, when we will put our probe in the medial side, of course, when we will put our probe in a short axis direction, transversely we will put the probe. Then our first job is to search for sartorius. Okay, this sartorius muscle, in a cross section, we will see that this is a triangular muscle, and there are two other muscles. One is adductor longus and one is vastus medialis. So vastus medialis will be in the medial side, and in the lateral side it will be the adductor longus, because okay, at the adductor side, adductor side, it will be the adductor longus, and otherwise it is the vastus medialis. And in this adductor canal, you will see that saphenous nerve. If you go distally, it becomes branched. If you remain with proximally, it remains bigger nerve. Okay. Then comes ankle block. Not ankle block, nerves around the ankle. Okay. So when I come down, till now, we have understood that all nerves are actually coming from lumbosacral plexus, and there are 3 nerves. So in the front, it is the mainly femoral nerve. Of this one, your obturator nerve is actually for upper part only, upper thighs. And then femoral nerve is coming down, and from posterior side, it is the sciatic nerve. So at the below the ankle, there are some branches, and they make the newer nerves from contribution from these nerves, these original nerves. So actually around the ankle there are 5 nerves, 2 medial, 2 lateral, 1 anterior. Okay, so 2 medial is posterior tibial saphenous nerve, and 2 lateral is superficial peroneal and sural nerve. Okay, 1 is anterior, that is deep peroneal nerve or anterior tibial nerve. Both are same nerve actually. So let us see. Here you can see that this is the supply of your dermatomal distribution. So saphenous nerve, it is in the medial side. Just remember that in medial side we have 2 nerves. So one is saphenous nerve, one is posterior tibial nerve. So saphenous nerve is supplying this area, but posterior tibial nerve, where it is supplying, it is actually going, it is again giving few branches and making the medial plantar nerve, lateral plantar nerve, or tibial nerve. So it is supplying the sole. It is supplying the sole and coming in the medial side, saphenous nerve, and then this part is supplied by. This is also medial side, so posterior tibial nerve. Then comes one nerve. Two is okay. Lateral side 2 nerves. So what are they supplying? So superficial peroneal nerve. So it is, since peroneal nerve is in the lateral side, so the branch of superficial peroneal nerve is also in the lateral side. And there is another nerve, that is sural cutaneous nerve. So superficial peroneal and sural cutaneous, they are sural nerve, not cutaneous, sural nerve. So they are supplying the lateral side of the leg and foot. And another nerve is there anteriorly, comes like this, that is deep peroneal nerve or anterior tibial nerve. So this is supplying only the first web space of the foot. Here you can see the sural nerve, it is coming laterally, but it is formed by the contribution of both the peroneal and tibial nerves. From both the peroneal and tibial nerves, it is coming like that. And then this peroneal nerve, this is the posterior side. We are seeing from the posterior side. If I see from the posterior side, if I see now anterior side, then you can see that the peroneal nerve, after coming in the anterior side from the this fibular neck, it is actually giving multiple branches. Okay, so there is deep peroneal nerve and there is superficial peroneal nerve. This superficial peroneal nerve will catch laterally, and deep peroneal nerve and anterior tibial nerve all are same. This will also we'll see here. So you have understood for blocking ankle, for ankle block or I mean doing any procedure also, most of the time in plantar fasciitis, when we inject plantar fascia, then we give the injection at posterior tibial nerve, medial side, posterior tibial nerve. And what will happen? If you give injection at the posterior tibial nerve, then whole this foot area, it becomes numb. It becomes numb mainly. So then you can give a intervention in the plantar fascia intervention. You can do in a much patient will not feel the pain. Okay, so as we understood, we will search all these five nerves. Okay, so syphilis nerve, a medial side, and posterior tibial nerve, medial side, lateral side, two nerves, superficial peroneal nerve and sural nerve, and deep peroneal nerve in the front side. And remember, these nerves are notorious to cause neuropathies. Which neuropathies? Post-procedural neuropathy, many scar tissue, if any post-surgical neuropathies also are there. So this causes neuropathies. Then we can go for hydrodissection. Sural nerve neuralgia, many times we get it because this nerve is used for biopsy purpose, for a vasculitis, autoimmune diseases. They do biopsy. After doing biopsy, the patient gets neuropathy sometimes. Then you can go for sural nerve hydrodissection. Okay. So okay. Other this is the lower limb. From upper limb. Dr. Devjyoti will talk about mainly it is the as we know all these things, all the upper limb nerves, upper limb nerves. There are three nerves. So radial nerve, mainly the posterior side of arm and forearm, and medial nerve and ulnar side, and medial nerve also in the front side of the arm. It is supplied by median nerve. So they are formed from the brachial plexus. Now brachial plexus block can be done, or it can be approached from different approaches. So all of you know, I think, interscalene approach, supraclavicular approach, infraclavicular approach, costoclavicular approach, axillary approach. So multiple approaches are there. So we can show few approaches at least to see all the nerves of brachial plexus. Okay, let's see. Actually, today our volunteer has not come yet, but still, let's see. Any question from here? Do you have any question? Otherwise, I will go for demonstration. But do you have any question?
Yes. Yes.
Hello. Okay, fine. So, they will be discussing on the important nerves, where to look at and how to block. So, these are very important things. Now, at the level of the elbow, we have the three important nerves of the upper limb. First of all, it's the radial nerve. Then we have the ulnar nerve and the median nerve. Now, radial nerve, if we have to look for slightly proximal to the crease of the elbow. So, the area is slightly at this point. Okay? And here we'll be looking mainly at the wavy bony margin. So, how? I will show you how when I'll be demonstrating. So, after seeing this wavy margin of the upper limb, of the lower part of the humerus, we have to slightly move up and we have to focus on two important muscles. So, what are those? Number one is the brachioradialis, which will be at the side, and one is the brachialis, which will be at the center. So, these are very important landmarks to find out the nerve. So, for optimal visualization, position your probe just above the lateral aspect of the elbow. The orientation should be the intrafascial plane between the brachialis and brachioradialis. And you have to place the transducer in a cross-sectional view or the short-axis view with the nerve, usually 3-4 centimeter above the crease. Now, how the radial nerve looks? Like all other radii, remember, the look of the nerve is quite dependent on its periphery. That means which structure is around. That means if there is a very bone close to it, then you will be seeing nerve as a hypoechoic structure. If it is within the muscle, you will be seeing the nerve as a hyperechoic structure. Okay? Because the machine always averages its position according to the tissues present around the nerve. So what happens? Here when we see the radial nerve, as around the nerve there is muscles, so it will look like a comparatively hyperechoic area with honeycombing. That is the typical pattern of the nerve. But remember, not all cases. But for radial nerve, it should be the honeycombing pattern of the nerve. And here the nerve usually branches into two. That is the superficial branch of the radial nerve and a deeper branch of the radial nerve. So the superficial radial nerve will continue and the deep branch of radial nerve will pierce the muscle. Which muscle? Can anyone tell? Can anyone remember? Anyone please? Which muscle is pierced by the radial nerve at the elbow?
Pronator.
Yes? It is the no. It is the median nerve actually pierces the pronator teres. But this radial nerve pierces the supinator muscle. Okay. And at the entry of the supinator muscle, there is a ligament that is known as the ligament of Froche. And if there are compression of this ligament of Froche over the nerve, it can cause a condition that we sometimes need to treat is the radial tunnel syndrome. Okay. So it pierces the superficial, it is the supinator muscle. In between the two layers of the supinator muscle, it pierces and then it becomes the interosseous nerve. So if we look in the anatomical slide, it will look like this. That means just above this crease of the elbow, it will be dividing and dividing into its two branches. One is the superficial branch and the other is the deeper branch. And this muscle is the supinator. You can see the crisscross fibers here. I made them translucent too, so that we can see inside it. So through these crisscross fibers, this deep branch will move to the posterior compartment or the dorsal compartment of the hand. So, as I told, there are two important muscles which will help us to find out this nerve. So, what are those? First of all, this muscle. This is the brachialis muscle. And just by the side, it will be the brachioradialis muscle, okay, which will be slightly lateral. Here see, I have removed the brachialis. So we can see it is in between the fascial plates of the brachialis and brachioradialis. Now, as we have moved the brachioradialis as well, then we can see this muscle. This is the superficial branch. It will continue, and the deep muscle will pierce the supinator, and it will come to the posterior compartment of the forearm. So we have to locate it here at this point. So I will show it, but remember, as I told, the wavy margin of the lower part of the humerus is a very good guide for where you are in case of a disc. Sometimes we call it home page view or home view as well. So, and this is the deep branch of the radial nerve as I shown, and this is the continuation of the superficial branch of the radial nerve. It will again supply to the 3.5 fingers of the dorsal side of the hand. So, we will be able to see this nerve below. But as this is very small, if you have a very good machine, you will be able to observe. But for average machines, it is very difficult to appreciate this nerve here at this point. It will remain close to the dorsal compartments. As you are in the basic class and you have not do not know the compartment, so I am not going into further details of it. Now coming to the median nerve of the at the elbow joint. So median nerve here it is also close. It is situated close to the elbow joint, and it is much superficial compared to the radial nerve. So where it lies? It lies close to the brachial artery. Now, artery is a very easy to diagnose structure. In fact, in ultrasound, we usually try to find out two structures. One is the artery or other is the bone. These are easily locatable. So just follow the brachial artery. Actually, it remains closer to the brachial artery at the level of the elbow joint. Now, as it goes down, just we have to place the transducer here at this point. Okay. So, you either, if you want, you can palpate the brachial artery and then you can put a transducer in a long axis, sorry, short axis view over the artery, and then you will be able to see the honeycomb pattern of the nerve close to that structure. Now, if you scan proximally, you will be able to see both the nerve and the artery towards the axilla. They usually codes together above. But as we go distally, it no longer remains together. Rather, this median nerve goes under the pronator teres muscle, and then it remains under the flexor digitorum superficialis and flexor digitorum profundus. So, identify this median nerve, there are two spaces where it is very easily locatable. Number one, when it is close to the brachial artery, then you can get it by finding the brachial artery at the level of the wrist, or you come at the mid forearm level. There, only it is between two muscles, that means digitorum superficialis and the digitorum profundus. So, here, as I told, when a nerve is in between two muscular structures, it becomes very hyperechoic. So, you will be able to see as a popcorn style like structure in the mid forearm, and it is very easily locatable at this point. Okay. So, let us see. Monitoration. ফোন করো তারপর খুলে দিস চাবি নিয়ে ফোন তারপর so here as I am showing, this is the artery and very close is our nerve. Now remember, at the wrist you will find these two structures very close. That means if the brachioradialis is at the center in one side, let me do one thing, because when I'm telling and you are not getting any visual impression, it is a little bit difficult for you to understand. So let us show you in the map, so that in the 3D video, it is very easy for you to understand. Okay. So just I have opened the 3D atlas. So what I was telling, just I am just removing this cutaneous branches and see. Here we have the biceps brachii. But remember, close to the wrist, the biceps brachii becomes very small and it is tendon-like. So we cannot see this big biceps brachii at the level of the wrist. If you go slightly up at the level of the arm, it is so big muscle. But below, only this portion of the tendon remains close to the elbow joint. So let's hide it. So now we are actually with this brachialis and brachioradialis. Now again, I am removing this superficial branch of the musculocutaneous nerve, and this is the median nerve. So here median nerve is very superficial. And let me remove the pronator teres. So see, there are two muscles, one center, this is the brachialis, one at the lateral side, this is the brachioradialis, and medially there is the pronator teres. So if we scan, so in the mid portion we'll be getting the brachialis, in lateral portion we'll be getting the brachioradialis, and in the medial portion we'll be getting the pronator teres. So in between these two muscles, that means brachialis and pronator teres, which passes, it is the median nerve, and then it actually pierces the median nerve. See, and the median nerve continues. And here, if we remove these two muscles, that is the flexor carpi radialis and flexor carpi superficialis, then you will be able to see it goes behind this arcade of the flexor digitorum superficialis, and then it comes in between. So superficialis I have deleted. Just 1 minute. Let me do undo, and I'm keeping this nerve here. Okay, all the structures I am keeping here, and I am making transparent. Okay, so see, now this muscle has become transparent, and you can see this nerve actually goes under this superficially. So let us remove the superficialis also. Then you will be getting this nerve under here. Okay, so let me go back and do a lot of undo. Okay, so you can understand the course of the median nerve here. Here it is coming, then piercing this muscle, then it is under this arcuate arc of this origin of the flexor digitorum superficialis, and then it lies over this superficialis and profundus. So it is the profundus, and previously superficialis I have deleted, and it will continue and it will come at the level of the carpal tunnel. So we can trace it very easily here when it is close to the muscle. We can trace it here when it is at the level of the, just one water. Okay, I have actually selected a lot of structures. Okay, okay. So here at the structure, I'm just hiding few superficial structures. This is the palmaris longus I am hiding. Then you can get this area, and here you can see this is the flexor retinaculum or the transverse carpal ligament. This nerve, as I have told it, I'm just 1 minute. Let me remove some superficial this cutaneous nerves, otherwise it's difficult to identify. Then we have to delete this. Okay. So now we can see, after hiding this palmaris longus, we can see this is the nerve. Okay. And here it is divided into two branches. One is the palmar branch and one is the common palmar digital nerve. And remember, then it is coming at this point at the level of the carpal tunnel. Now, here, as I told, entering to the pronator teres is an area where there is a possibility that this nerve can be get compressed. Okay, and this is known as the pronator syndrome. When the median nerve is compressed while it is either piercing the pronator or it might get compressed behind arc of this flexor digitorum superficialis as well. Or the more common area of compression is this flexor retinaculum. And when it is compressed under this flexor retinaculum, this is known as, can anyone tell? The very popular name, very common name, common disease.
Carpal tunnel.
Yes, that is the carpal tunnel syndrome. Okay. If we have to do a hydrodilatation, we have to do at the level of carpal tunnel. So in the carpal tunnel syndrome, now you know there are a lot of studies and lot of studies are going on this hydrodissection of the median nerve at the level of the carpal tunnel. And it's a very good conservative way of management of the carpal tunnel syndrome. So we'll be following this nerve at this point as well as at the wrist. But we have another nerve left at the level of the wrist. So let's go back to the slide. Okay. So as I have told, it has pierces the this nerve and then this pronator teres and then it has gone down. Ulnar nerve, where we found the ulnar nerve. Can anyone tell? Where in the wrist we can found it? It is close to the medial epicondyle. Okay. Sorry. It will find it here. It is the mainly you have to focus in between these two structures. Okay. So we have to get it, but here which is close, muscle or bone at this point. At this point, the nerve is close to a muscle or a bone.
Bone.
Then it will look as hyperechoic or hypoechoic.
Hypoechoic.
Hypoechoic. So ulnar nerve at the wrist, at the elbow is always hypoechoic. So it will look as a hypoechoic structure at the level of this medial epicondyle. So if we try to bridge between these two bony prominences, one is the medial epicondyle and one is the olecranon process. As the nerve is going in between, we will be able to get a hypoechoic structure here. And this is the ulnar nerve. And another thing, here nerve might get compressed. Okay. And this is known as, again, very popular name of the disease. Can anyone tell? Very simple. Carpal tunnel, and this is cubital tunnel syndrome. Okay. So here also it might get compressed and leading to the cubital tunnel syndrome. So to find out this nerve, it is very easy. In fact, sometimes what happens, there is accidental injury and you will get some sensation here as well. So you have to get it in between these two structures. And sometimes there is a fascia covering it that is known as the Osborne's fascia. And if there is contraction of this Osborne's fascia, this nerve will get compressed. Okay. Now coming to the carpal tunnel syndrome, as I have already discussed, it's a condition which is associated with the pain, numbness, and tingling of the hand and arm. The condition occurs when a major nerve with the hand, the median nerve, is squeezed or compressed as it travels to the wrist at the carpal tunnel level. Remember, we always read the bones like this. Okay, that means from below proximal to distal, scaphoid, lunate, triquetrum, pisiform, then trapezium, trapezoid, capitate, hamate. But as these cubic carpal bones are not always placed in a two-line fashion. Some carpal bones are longer and some carpal bones are shorter. So while scanning this bony margin, usually we cannot see four of these carpal bones together. Usually at the proximal portion, we see three bones. That means this is the scaphoid, then we have the lunate, and then we have the triquetrum. So this lunate is a very large bone and it is projecting towards the superficial side. So as we look at the proximal carpal tunnel, bony contour will be like this. That means one side it will be the scaphoid, in middle it will be the lunate, and in other side it will be the triquetrum. But you will not be able to see the pisiform at the same view. See, in the proximal carpal tunnel, how to understand this is in proximal carpal tunnel by seeing the lunate, as it is a very prominent bone there. As we go to the distal carpal tunnel, so here just look at the picture, right? What happens here? One side we can see the pisiform, so it is here. Then we see portion of this triquetrum. Then we see portion of this hamate. Hamate is the from the anterior layer. Then we'll be able to see small portion of the capitate. Then we will be able to see the scaphoid. But at this point, there is a very important structure we have to look. Between the scaphoid and the pisiform, usually you will be able to see this structure that I will show while scanning. And this is the transverse carpal ligament. Here it is very not much clear, but here just see there is one structure. I will show it much clear way when I will be scanning. So this is the transverse carpal ligament. Under this transverse carpal ligament or flexor retinaculum, we will be able to see the median nerve. So that is where we have to look for the median nerve. Now there is another nerve, that is ulnar nerve. But ulnar nerve and ulnar artery usually lies superficial to the flexor retinaculum. Okay, so we will be seeing these nerves today in the class. So as our volunteer has already arrived, and I think you have understood this important nerves of the upper limb. Do you have
Yes,
any
sir.
question? Okay, fine. So Dr. Roy first will be demonstrating the lower limb and the brachial plexus as well. Then I will come to the other nerves of the upper limb.
Sir, I have one question.
Yes, yes, welcome.
Uh, can we inject at any level on the nerves? Is there any levels that we should avoid
The
injecting?
question is, I understood your question. The question is, for which purpose you are doing? Okay. Suppose you are doing for a surgery, then you have to think of the cutaneous branches as well. So you have to branch at a proximal level before this branches actually starts. But if you are looking for a compression of the nerve, actually, truly speaking, as I do not do anesthesia for long, it is I am doing pain for I think more than 12 years it is now. So now we actually inject at the area where are the common sites of the compression. For example, we inject at the level of the radial tunnel, we inject at the level of the carpal tunnel, we inject at the level of the cubital tunnel to do a hydrodilatation, okay, to free the nerve from this compression. If you are doing for a block, okay, that means for a surgical indication or a pain management, especially for an acute pain management. The patient has got an injury and now the patient is screaming in pain. There are a lot of contraindication. You cannot give drugs. In those conditions, you can block at a place where all the branches you are able to cover. That is the simple way of understanding where you have to block. So for the acute pain management, it is quite easy because at any point you can give, but when it comes to the chronic pain management, then we have to inject at the level of the compression of the nerve to free the nerve from that area. Understood?
Yes, thank you so much.
Welcome.
Okay. Share screen. Okay. Can you see the screen?
Yes.
Okay. You can hear me also. Can you? Okay. So, screen is full screen, isn't it? Yeah. So I think it's okay. Hmm. Right. Please restart screen. Just stop. Okay. So let me start with the ankle block nerves. Nerves of ankle. I think you can see the see me, no?
Yes, but it is not the full screen, sir.
Okay, just a minute. It's fine. হচ্ছে না। Just a minute. আমি ফুল স্ক্রিন আসছে না, দেখছো না? এই যে নিচের দিকে কি কি সব আসছে, পাটাও আমি ঠিক করতে পারছি না। আই ডোন্ট নো।
তুমি তোমার মতো ইয়ে করো, বন্ধ করো, স্পটলাইট করা বন্ধ করো, তাই চলে আসবে। তুমি স্পটলাইট করে রাখো বলে আসবে।
এখন রিমুভ পিন,
রিমুভ বিল করো, হ্যাঁ চলে আসবে।
রিমুভ স্পটলাইট। কিন্তু আমি এটা এখানে ফোকাস করতে পারছি না এটা দিয়ে। ওকে। Okay, so I am searching for posterior tibial nerve. Okay, first this is the medial side. This is the medial side. So I am putting the probe in a. This is a high frequency probe, linear probe. Okay, linear probe, high frequency, and I am putting it in a transverse orientation. Okay, so here in the middle left side of your screen will be the medial malleolus. Left side will be medial malleolus. So here, if I put the probe like this, then what are the things we are seeing? First, let us see this one, this area. Just a minute. Oh, okay. So this is the scribble. So you can see this is the medial malleolus. Okay, this is one tendon, this is second tendon, and third tendon is actually here. What is this tendon? Tibialis posterior. This is the flexor digitorum, and this is the flexor hallucis longus. Okay, here in the medial side between second and third tendon, this is the neurovascular bundle area. This is the neurovascular bundle area. So here vein also will be there, artery also will be there, and nerve will be there. So if I target this area, then I will search, I will see these nerves. This is the nerve. Okay. More distally I will go, I will see that this nerve will become two. But proximally if I go, then I will see a big nerve like this. Here it is, this picture is of a bit proximally. So these nerves are just coming out, but it is still a big nerve. Okay, so I show you again from medial malleolus. This is number 1, this is number 2, and here it is third tendon. So between second and third, this is the neurovascular bundle. So see again. See again. So first tendon, second tendon, there is neurovascular bundle, and below that there is the third tendon. So that third tendon is also, I mean, with muscle a bit, whatever. So you can see the neurovascular bundle. If I go up, then all the vessels will become one, and the nerve will become much bigger. This is the bigger round nerve. This is big round nerve. You can see this is the big round nerve. Okay, if I come down, it gets divided. Actually it gets divided, a bit smaller, and now it is getting divided and smaller. Okay, now it is getting divided and smaller. If I go up, then it is a very big nerve. This is a very big complete nerve. Okay, so yeah. So this is the location of posterior tibial nerve. This is the location of posterior tibial. Now let us see the second nerve, which is the syphilis nerve. How I shall see this in the syphilis nerve is actually a very subcutaneous nerve. You will hardly be able to see. So here we target the great syphilis vein. One vein we target. Okay. So where is that? We will search over the medial malleolus. Just we will start from here and we will go around 5-6 centimeter above, and we will see that there is a big vein in the midline, and so this is malleolus, and gradually we will go. We will of course decrease the depth. We will decrease the depth to the very low level because it is a subcutaneous nerve, and here as soon as the vein comes, so let's see. Yeah, so this is the vein, and just by the side of the vein there is a neural structure. There is a neural structure just by the side, right side of the just by the right side of the vein there is a neural structure. Now just below the yellow mark, there is a, just below the yellow mark there is a honeycomb like appearance. You see small honeycomb like appearance. So this is the nerve which is the syphilis nerve, and you see the depth. It is not even 0.5 centimeter. It is just subcutaneous, just under the skin. So here this nerve is actually blocked by only subcutaneous infiltration. Okay, and you have to put the probe very lightly, otherwise this vein will vanish. So very lightly, so that we can see the nerve just around the great syphilis vein. Here this is a honeycomb like appearance. Okay, this under the yellow mark. Okay, under the yellow mark. Okay, so these are the two nerves in the medial side. I see one nerve in the front side. What is that? So in the front side, see here একটু ভাঁজ করে দিন, এরকম রাখ, হ্যাঁ হ্যাঁ, okay, okay. So here see left side is lateral side. Left side is towards lateral malleolus, and right side is towards medial malleolus of your screen, I am saying. So I will increase the depth a bit, not too much. Okay, so this is the depth. Here you remember we will search these nerves above talus bone. This bone is talus. Okay, this bone is talus. But if we go up, then in this area, see, there is no bone, bony architecture, the bony contour you will see, and there is nothing. If I go up, then it is the tibia. Tibia in this area, you will not see any cartilage mark. How will you know that from tibia to talus has come? So this is, there is no cartilage above the white periosteum. As soon as I go in this area, there is nothing. It is the space. Okay. Now I come over the talus. So in this area, I will search for three tendons here. So here in the lateral side, in the left side, but then from medial to lateral, there are three tendons. Which what is that? We say mnemonic by Tom Heredic. So tibialis anterior, and then uh, this one extensor hallucis longus, and then extensor digitorum longus. Here also, like in the medial side, between second and third, I will search for the this one, your all neurovascular structures. I will search for neurovascular structures. So you can see just at the corner, at the margin, you can see that first tendon. Okay, this is the first tendon at the margin. I have kept it at just at the margin. A second one also you can see. I think you can clearly see that this is the second tendon. So if you see first, second, and third, three tendons are clearly seen. Okay, I am just making you wait. Just I will freeze it, otherwise it becomes difficult. Okay. Huh. So here scribble pen. So here also first, second, third. This is the one tendon. This is second tendon area, and this is third tendon area. Remember, white part is tendon, black part is remaining muscle. More distally I will go, it will become totally white and tendon. But more a bit proximally when I go, then there is some muscle fiber. So over the talus in this area, it is common to see black and white, both muscle and nerve. And between these 2 and 3, we will search the neurovascular bundle. Every time it is not that fixed that okay, this is just like this in this area only, but it is around. So here I can see one vessel and one nerve. This one is nerve and this one is artery. See carefully again. So this one is the your anterior anterior tibial nerve or deep peroneal nerve. Okay. So see again. Okay. So I can see again, I am coming just over the talus. Just over the talus, there are three tendon areas. You can see if I go a bit distally, it becomes completely white. But if I say I remain a bit proximal, then black and white. Three balls are there, black and white. This black part is nothing but the muscle, remnant muscle. So if I go a bit distally, then you see more white, and this neurovascular bundle becomes much clearer. But in this area, in between, the middle part is the black artery, and in the right side also there is small nerve, and in the left side also there is small nerve. Means it has branched, actually it's branched. But if I go up, then nerve remains a bit bigger, but now it is just above the artery, just above the artery. Okay, you can, I think you can see clearly the artery in the midline, in the midline portion, artery, round artery just above the artery, that is the nerve. When I go down, this nerve now actually has come in the right side, and of course some part is in the left side also. Now it is branched. Okay, but if I go proximally, then this is the complete nerve. So this is the anterior tibial or deep peroneal nerve. This one. Okay, now let us see one nerve, two nerve in the lateral side. we have see two nerves in the medial side, one nerve in the anterior side, and two nerves I will show in the lateral side. ওই এই যে এরকম কর হুম, হুম, আরো ঘোর হুম, না এরকম এটা কি বাজে সাউন্ডও যায় না, মানে কি করবে বলো তো, কেন? আচ্ছা, সো আই থিঙ্ক ইয়া ইট ইজ দেয়ার। অন্যখান থেকে তুমি ইয়ে করো, এখানে তো আসছি। ওকে, আবার তো চলতে থাকো। ওকে, সো laterally I will search for two different nerves. Yeah, loose. Okay, so one is here laterally sural nerve, one is sural nerve and one is superficial peroneal nerve. So to first let me search for superficial peroneal nerve. Remember, in superficial peroneal nerve, it is between two compartments. One is your peroneal compartment, that is there this side peroneal compartment, one is anterior compartment. Okay, between this compartment I will search for it. So how will I will I find the between these two compartments? I will start from lateral malleolus, a bone, this type of heel type of bone. Okay, if I go up, then I will see left side one compartment and right side another compartment. Okay, so now this compartment thing is much clear, and just below the yellow mark, just below the midline yellow mark, you see there is a space which is between two compartments. Okay, so here I will search for the nerve, that is the superficial peroneal nerve, and this is very clear actually. This is the superficial peroneal nerve, and this bone is nothing but fibula. This is bone is nothing but fibula. Okay, so this is the anterior compartment and this is the peroneal compartment. I am not going in detail of which muscle is what, but between these two compartments, this is the common superficial peroneal nerve. Just see again, I have started it from fibula. I started it from fibula, I went like this, and once from right side it is anterior compartment, from left side it is the peroneal compartment, and in this area where it joins, I can see that directly there is a nerve in this area. I mean that is the superficial peroneal nerve. Okay, it is going a bit in the right side, but in general superficial peroneal. Okay, so another nerve is sural nerve. Sural nerve, you have seen that sural nerve has contribution from both the nerves. Okay, sciatic nerve, and then this one, both the nerves have some yeah, that. So let us see, common peroneal and tibial both has the contribution. So here what I will see, so here also I will put my probe in this transverse direction. Left side of your screen is this side, like heel side, and right side of your screen is actually lateral malleolus side. Here my target is to see the Achilles tendon in a cross sectional manner. So let me see in left side this Achilles tendon I can see or not. So I can see the in the just under the yellow mark I can see the Achilles tendon in a cross sectional manner. Okay, this is the Achilles tendon completely. And so I show you again, it will be better to see. Yeah, so try to understand this thing. This is a tendon in cross section. Okay, and this side, right side, I will go for another bone, that is the lateral malleolus. So I will, my probe will be, it is in a from Achilles tendon cross section to the lateral malleolus, and then in between I will search one vein that is called small saphenous vein. It is very easily searchable, and around the small saphenous vein, small saphenous vein, I will search for the artery, because everywhere it is a neurovascular bundle. Not artery, nerve. Okay. So let's see. So again, this is the left side of the screen is the short, cross section of Achilles tendon. Right side, it is the lateral malleolus. Between these two, this is the small saphenous vein, which is just below the yellow pointer. Okay. Now here I will see one nerve. Can you see one nerve? Just left side of the black vein. Just left side of the black vein. হ্যাঁ এই তো আরো ছোট করবো okay I am decreasing the depth a bit though আমি তো ইউজ করি হ্যাঁ see big nerve so this nerve is nothing but the sural nerve just under the yellow mark okay and this is around the small saphenous vein okay so these are the all 5 nerves I have shown above around the ankle so next I will go for knee nerves okay just ঘুরে যাও sciatic nerve from the popliteal sciatic nerve পুরো I will show you now so as I told you here there is one trick is there one trick is there and that is simply go for searching the biceps femoris margin so where is the biceps femoris margin this side is lateral side this side is medial side so this there is a triangular area like this way like this triangular area doesn't have any tissue it is I mean it is loose areolar tissue you will be able to understand in your own body you see that here it is a muscle here it is a muscle and in between there is a loose area so you can clearly catch this is a muscle and this is a muscle so this muscle is nothing but the semitendinosus semimembranosus medial side and what is in the lateral side this lateral side is actually biceps femoris so peroneal nerve must come at the margin of the biceps femoris it must be there at the margin of the biceps femoris peroneal nerve okay so first we will locate the peroneal nerve and then we will search other nerves so it becomes much easier okay so let's see you can actually sometimes put a pillow under the foot so that this leg becomes a bit flexed and this area becomes more lax and you can scan better so anyway so here as per the patient's thigh if it is too thick then you will go for curvilinear probe otherwise I am trying this one only let's see if I can see or not so here also the same technique first I am going to show you okay so this muscle I can palpate also this muscle so this looks like the biceps femoris okay this looks like the biceps femoris so here I will just see the margin of biceps femoris in between there is nothing so this is biceps femoris so I will just okay so I know where I have hold the probe so scribble so I know where I have put the probe so this part is biceps femoris okay so this is also the muscle area this is also muscle so biceps area so I will go a bit distally and I will try to see if something comes here something means our nerve comes and joins the margin okay. That I will look for it so same thing I'm going so this is biceps femoris left side my probe your screen's left side is lateral side of the patient. So biceps femoris I can see. Now I am coming down, 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 and suddenly you see something has come and joined biceps femoris margin. Okay, you can see two black dots. Something has come and joined the biceps femoris margin. It is black, but it is if I go a bit more in this way, then it becomes the honeycomb just by the side of the biceps femoris, under the yellow spot. Okay, if I go a bit proximally, it goes down, but if I go distally, it comes here and just at the side of the biceps femoris. So this is nothing but the peroneal nerve. So if you can locate the peroneal nerve, then you can locate the common tibial nerve also. Now it is going down and it is joining with another nerve. So that is the sciatic nerve, and so this nerve is the sciatic nerve. Let's see if maybe you have not seen some people. So I will show you. This is the sciatic nerve. So common peroneal nerve has come like this. Okay, common peroneal nerve was there and it came like this to join in this area. So see again. So again biceps femoris. So I am going just up and down, and suddenly I see that something is coming to the biceps femoris margin. Okay, biceps femoris margin. Suddenly I have seen. Okay, now as I have already seen the biceps femoris, I will go a bit up to find where it joins with another nerve. So can you see another nerve is coming from the right side and it is joining. So in this area it is quite deep, so you cannot see better, but this is the sciatic nerve area. Okay, this is the full sciatic nerve, and then this is the division. So just now it divided. This is the divided. Okay, divided and joined. So divided and joined. I think you can see clearly. People have perceived or not?
Yes,
Okay.
sir.
Okay. Hmm. Okay. So this is the sciatic nerve. Now if I go laterally, I can see actually you just see under the yellow. I will keep the peroneal nerve, and you can go up to the fibula also. So this is the peroneal nerve. I'm going down. See the bony architecture. Gradually, it will cross the condyle and it will directly come over the fibula. Now it is the fibula. Fibula is like this type of thin hilly architecture. So this is just around the fibula. This is the fibular common peroneal nerve. It's a fibula. This is fibula just above that. Yeah, under the yellow mark. Under the yellow mark, if I go again, it will become the nerve. Okay, again it becomes the nerve, and it is coming around the fibula, neck of the fibula. Okay. So this is done. Now posterior side of the knee I have shown. Now anterior side of the knee. Okay. Teacher. আস্তে আস্তে করে উঠ। হুম। শঙ্কর, হ্যাঁ, তাড়াতাড়ি, যা, তুই চলে যা। এটা হ্যাঁ, now I am bringing the our thin volunteer, otherwise we will not be able to see anything. আচ্ছা, তুই নিচে আয়, তুই নিচে আস, on নিচে আয়। Okay. Let's see. So नहीं दिख रहा है। ऐसे इसको जैसे उठ, मैं तो कुछ भी नहीं दिख रहा है। हाँ, इसको सीधा कर ले। हाँ, okay. So this is the thigh area. So here what I will see, the adductor canal for Syphagus nerve. So this is a very easy nerve. just how the structure, how you where you will find it is between below sartorius. One side this is the vastus medialis, one side it is the adductor longus. That's it. So adductor longus, it is difficult to find it. So we will go with the vastus medialis. We will go with the margin of the vastus medialis, and then we will go to the just below the sartorius. Okay. So first let us see the vastus medialis first. So you can see that this is the femur, femur cross section, femur cross section. So what we are seeing, the vastus medialis, it is there, and we will go. So this is the big vastus medialis. Okay, this is the, when we come down, it becomes smaller. It becomes smaller. So vastus medialis in this area it becomes small. Otherwise, this is vastus medialis is the biggest muscle of all quadriceps. Okay. So here, the margin of the vastus medialis, now I will go up and I will see a triangular muscle. So now it is at the margin of the vastus medialis, left side of your screen, it is the vastus medialis, and middle of the screen it is the triangular sartorius, and right side of your screen is adductor longus. So in between them, in all these three, this I mean like this triangular area, this is for the neurovascular bundle, and here actually this syphilis nerve is there, and it has some branches. It has some branches branch to the your adductor longus and all. So muscular branches are there. You see just below the black spot, just below, that is also a, you can see below also, and left side also you can see when I'm toggling the probe, there is a honeycomb like appearance. In the left side you can see between the sartorius and vastus medialis, between the fascial sheet, this white part is also honeycomb like. This is also honeycomb like, and below the black artery, it is also honeycomb like. So these are all nerves. These are all nerves. So this is the কিন্তু নাইলে তো দেখতে পাবে না ইয়ে honeycomb. This is two honeycombs now. Have you all perceived any problem? Clearly perceived or not?
Yes, sir.
Okay, if I move it so much so that you see the nerve honeycomb appearance, otherwise it remains. Okay, so this is one thing around the knee. Now let us see the femoral nerve, obturator nerve, and sciatic nerve from anterior side. But I don't know my volunteer will allow or not. Let's see. ঠিক আছে ঠিক আছে ঠিক আছে accept me. তোর চেহারা দেখা যাচ্ছে না, নেই কিছু নেই, আমরা শুধু ইয়ে করছি। বাস বাস ঠিক আছে। Okay, so I will show the first, I will show the femoral nerve. So femoral nerve is very easy, but then I told you here also the same protocol, that I will go with the margin of iliacus, mainly iliacus. So where is iliacus? Or yeah, actually both the things can be in your mind. Either you go for iliacus muscle and margin, or you go with the this one, your neurovascular bundle, VAN. So here, as soon as when I move like this, where is that? Oh, এরকম কর। Okay. So he was so much. Okay, so it is like oh, probe is not visible, no? Wait. So this area, I mean, I don't have an option. So this area is groin area. Okay, this is groin area. This side is lateral side, and this side is medial side. This side lateral, this is medial, and I am not seeing anything. I am just trying to see that whether I can find the vascular structure. Actually, as soon as I see like this, I know that I am on the femoral head. This is a round structure. You can see this is a round structure. So this is femoral head, and above that there is cartilage. Okay. So whatever muscle is there on the, okay, my probe is wrongly placed. Left side is lateral side. Okay. Left side is lateral side. So I know this round structure is nothing but femoral head, and there is cartilage. So any muscle just above the femoral head, that has to be iliopsoas. That has to be iliopsoas. So big muscle under the yellow spot, that is the iliacus muscle. Psoas is only small part in the medial side. Anyway, that we are not discussing now. We are discussing that at the margin of iliacus we must find the nerve, and other two vessels are artery, femoral artery and femoral vein. If I press more, then femoral vein will go, and now femoral vein has come. If I give a bit pressure, then it goes. Artery is there, VAN. So this is the area where the margin of iliacus is there. There I should find the nerve. So I decrease the depth here. I think I should a bit more. Okay, so see, nerve is there or not? Nerve is flattened, completely flattened here. So this is common in this area. Nerve is flattened. This is vein, artery, and nerve. Nerve, I show you uh, just at the margin of the. Mhm. Yes, yes. So this is the nerve. This is the nerve. This is flattened nerve. This is at the margin of the iliacus. Margin of the iliacus. Here, see, artery. Two arteries are there. What does it mean? It means that I am a bit distal. If I go proximal, it will become one. Okay, but the nerve will remain flattened here. So this is the here nerve is under fossa iliaca. Fossa iliaca. Okay. So I'm not going in detail. So here you can see the nerve just at the margin of iliacus. Okay. Okay. Now let me show you the obturator nerves. So where are the obturator nerves? Simply as okay. So simply I understood that, okay, these vascular areas are, I have seen. Now vascular areas are what? These are over the femoral triangle. Femoral triangle, I mean iliacus area. The floor of the femoral triangle is iliacus and adductor longus. So whatever I am seeing in the under the yellow mark now, I will go medially actually. I will go medially. So whatever I am seeing under the yellow mark, there is the big iliacus muscle. There is floor of femoral triangle. Then I am going medially more. Then I see three muscles here: adductor longus, magnus, brevis. Okay, so between this brevis, there is one branch of obturator nerve, and brevis magnus means second and third, there is another branch of obturator nerve. This I have to wait. Okay, ready? Just a minute. So again, the three margins. I am not being able to freeze. Okay, okay, okay. So here, I mean, scribble. So here, one muscle, two muscle, three muscle. Between this 2 and 3, there is one obturator deep branch. Between this 1 and 2, there is obturator superficial branch. Here, or anterior and posterior branch. Here, remember, this block is a fascia block. Fascia block. You cannot find the specific nerve there. You can find, actually, this is black. This small black spot. These are the nerves. So there is no need to search one black spot and block that. You will give local anesthetic in the fossa. Okay. So you see, these are three nerves, and these in these planes you see between 2 and 3 it is very easily seen black spots moving from left to right, moving from left to right, black spots. And from 1 and 2 it is also there, but it is not that clean, but then it is also there in that plane only. So you go for a fossa block there and you will be able to see. So this is a fossa block. Okay, and now in the midline it is there. Yeah, I can see. Or anyway, hmm, ঠিক আছে? So this is done. Now third is your sciatic nerve anterior approach. This approach is applicable only in thin people. So let us see again the just now I told you adductors. So these are all adductors. These are all adductors, iliacus and adductors. So let me increase the depth. Though he is thin, but still I have to see more depth. So I will go down, I will go down, 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 and I will see the full adductor compartment, full adductor compartment. You see just below, straight. So this just below the full adductor compartment, you can see this is the femur short axis round, and this is the sciatic nerve just below the whole adductor compartment. So he is very thin, but still the depth is 7 centimeter. So you can imagine what is the depth in the a thick portion, মানে thick patient. Yeah. So let us go with the একটু ঘুরে যা। Let us go with the হুম, না না পুরো পুরো full. হ্যাঁ হ্যাঁ হ্যাঁ। So only full পুরো 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 ঘুম যাও। हाँ ठीक है okay okay okay. So हाँ, here let me see only one portion, that is the here also I cannot show you the skin part much. Just I'm holding the probe. So this is the gluteal fold area. My target to see here also, I will just hold the probe in a short axis direction, short axis. Here left side is your uh, this one. Left side of the screen is the medial side. Left side is medial side and right side will be lateral side. Depth I have to increase a bit. So here my target is to find only two bony contacts. One is greater tuberosity. I think this probe is not, he is thin, but still this probe I cannot. So I have to go for the curvilinear probe. So the same thing, left side is your medial side, right side is this one, your lateral side. So right side I expect greater tuberosity, greater trochanter, and right left side of the skin, which is medial side, I expect the ischial tuberosity. What is that? So let me see if I can. The position is so bad. Okay. Okay. So in this area, as soon as I have found there are two bony structures, you see there are two bony structures in the midline. Okay. So one is right side, that is nothing but greater tuberosity, and one is in the left side, that is nothing but ischial tuberosity. After I have found the two bony structures, then I will decrease the depth, because I know that between this bony structure, the muscle which is there, it is nothing but quadratus femoris and gluteus maximus. Okay. Actually, wait, wait, his position is so. Hmm. Okay, so this is the 2A, and this is the sciatic nerve, but where I will show you, that is a. Okay, so this is the sciatic nerve. Freeze. Okay. Hmm? Zoom depth কমালে তখন আচ্ছা, just I tell them that which one is what. So this is one bone, this is one bone, this is one bone. Okay, this is one muscle like this. Oh, this is one muscle like this. Okay, here this is the gluteus maximus, and between these two, here is the nerve. This is the nerve. Okay, you see, again I show you. You see the nerve structure here. I If I decrease the depth. Oh, huh. So you see the nerve there. Okay, in a curvilinear probe you cannot see better than this, if the probe is not that here. So here, these two structures here, the two muscle groups are there, and between them, this is the sciatic nerve. This is the sciatic nerve. Nothing more than that. Okay. If I go down, oh, narale. Acha. Okay, I'm putting it holding. Actually, nerve is better visualized if you move. If you move continuously, then there is a I mean honeycomb appearance. Okay, now I am going down. You just follow this area. Maybe in downward area, you will now it looks more like a nerve, isn't it? But okay, so this is the nerve. Yeah. Huh. So here, don't try to. I mean, you always try to find two bony areas and then you search for the nerve. Otherwise, there is a common tendency to confuse between this nerve and conjoint tendon, and semitendinosus and biceps femoris conjoint tendon, that also look like you exactly same. So there is a common tendency. So this one is sciatic nerve. Okay. So now Dr. Devjyoti will show the uh, uh, okay, let's see. Any question or anything you want to ask here? Am I clear or not? This area. একটু ঘুরে যা। ও, একটু ঘুরে যা। নাহলে ওদিকে করবো। না, বসিয়ে না। হ্যাঁ, ওর পিছনে। Okay. Now upper limb and neck. So না, তুই let go. Let go. गले में उधर उधर देख। हम्म, हम्म, अच्छा, ये तो यहाँ खोल दे। जस्ट अ मिनट। हाँ, बाकी लोगों का सेंड कर दिया, ऑलरेडी ईमेल कर दिया। सब तो जाके बैठ गए। Okay, so let me see if तू उधर देख हाँ बस बस हम्म, हाँ. So I think you can see the no, ढीला छोड़, हाँ, हाँ, हाँ. You can see the neck part. Okay, so here brachial plexus, all of you know there is nothing more to show here. So brachial plexus, as soon as I put the probe here, the linear probe, I can see this is the first rib, and just in the midline, it is the first rib. This is a supraclavicular approach. Of course, this is a supraclavicular approach. So first rib, and below the right side and left side, this is the pleura. Just above, I mean the artery, you can see the subclavian artery, and just beside that, this is the big chunk of, you can see the brachial plexus. So brachial plexus together you can see. So this is a supraclavicular approach. I think all of you can see, no? তুমি mark করবে? So this is big brachial plexus around the artery, right side. Okay, anyway, so if I go up, I will see anterior scalene and middle scalene, and the all the branches, all the brachial plexus that is being formed. So here there is one traffic light sign. So this is actually the interscalene area. When I come down, this is your supraclavicular block. This is the supraclavicular area. Okay, actually you can see one nerve actually goes outside, but that is will be too much. Here the suprascapular nerve actually comes out from the brachial plexus. It is just going outside from the plexus. Now again it has come and joined. Now it is going out. So this under the omohyoid muscle, this suprascapular nerve goes from here. Okay, so this is one way of doing brachial plexus block. I think this much is okay. The brachial plexus knows, everyone knows. So let us see the mainly ulnar nerve, median nerve, and radial nerve at the knee, wrist level and elbow level. না ও বসবে বলছো? ও আচ্ছা, একটু उठ जा उठ जा, यहाँ पे बैठना है। हाँ, ठीक कर ले। ठीक है, वो साइड तो था।
Hello, am I audible?
Yes, sir.
Okay, fine. So usually for the wrist, we ask the patient in sitting position because patient is also comfortable, and usually either now I have put in the corner of the table, so that's the easy way, or if your table length is short, you can make the patient sit in the opposite side of the table and ask the patient to extend the arm. Now I have put one towel, just one minute. Okay. Okay. So just put a towel. Okay. So that we can get that door together. Wrist করবো, okay? Sorry, elbow করবো, okay? So we are just taking the probe, and as I told, this is the crease. We have to put it slightly proximally. Chill. So what we are doing? Now I am putting the aspect marker towards the lateral side. So this is the lateral side of the patient, and I am putting it towards the lateral side. And I am trying to focus. So here, as I put it, we can see a bone below, rounded bone. So what is the bone? Obviously, it is the humerus. It is the shaft of the humerus. But as I told, I have to come slightly below. So if we move up, we can see humerus and we can see starry night pattern. As I am coming down, the large biceps will be very small. So there is a big muscle, that is the biceps brachii, which is above. Okay. As I am coming down, it will become small and we'll be able to see the lower margin is getting changed. So you can see the wavy margin. I think I need to increase the gain slightly. Okay. Can you see it more better now? Okay. So in this picture, now one thing is very clear. Initially, what muscle we are seeing in large. So let me focus. This muscle here, which was very large at this point. Okay, as we'll move up, it will be much larger above. Okay, it will become large and large. But as I come down, this muscle is becoming very small, and this is the biceps. And as we are getting this wavy margin, now the muscles are very clear. We have a big muscle just above this wavy margin. Okay, so let me stop and I will show after freezing. So it's a very big muscle. See, this muscle is the brachialis muscle. Okay, this is the brachialis muscle. Here, as I told, this is the large muscle. It is the brachialis that we first need to focus. So once we have focused the brachialis muscle, then everything is very easy. Let me defreeze and I try to come back again once again there. And we can see brachialis and we are moving towards the lateral side. As we are moving towards the lateral side, we can see fascial plane between the brachialis and the brachioradialis. So let me stop and draw. This is the fascial plane between this portion is the brachioradialis and this portion is the brachialis. So now this fascial plane is very clear to everybody. Let me go back and check where is the nerve in this fascial plane. Again, I am coming on the same portion. Okay. Now, in this picture, I think we can see the nerve clearly here. Let me stop. Though here we can see two branches because at this point the nerve is slightly divided. So let me draw these nerves here. So can you see two nerves here at this point? Everyone is able to appreciate this nerve.
Yes, yes.
So this is the radial nerve. It is very easy to locate. So again, I am showing you the simplest way to locate it. Just follow the shaft, make it wavy margin. I have done 3-4 times, so it is very easy. And this rounded portion of the bone, which is showing very hyperechoic. Okay, so this is basically the capitulum. Okay, radius attaches with this capitulum. Now, as we are seeing two divisions, as we, and I'm making it slightly closer. Okay, now if we move slightly up, we'll see these two nerves becoming one. Okay, at this point, you can see one nerve there, two nerves has become one here. So this is the branch. This is the undivided radial nerve. Okay. So this, as I will move, it will divide, but above it is becoming more hyperechoic, and below it is slightly more honeycombed as because of the location. See, here we can see this is the radial nerve. And if we go down, it will, see, one branch will pierce the, one branch will go superior, and one branch will pierce a muscle here. See, one branch is still moving and it will go under the supinator. So this is the radial nerve. Any question regarding the radial nerve? No.
Sir, can you go proximally, sir?
Yes, I can go slightly proximally as well. So again, coming back, these two nerves now moving, 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 moving. Okay. Okay. Now it will go to the posterior side. I am not following because for this batch, I think this nerve tracing we do not have. So most important areas we'll locate. Okay. Next is the other most important nerve, that is the median nerve. Now, where is this median nerve? As I told, this in this area, median nerve is very superficial. So we have to either palpate the brachial artery, or we can see this brachial artery now. I have made it at the center of the screen. Can you see? In very superficial portion of the central of the skin, we are having this moving artery. So this is the just 1 minute. This is the artery. Now just in the lateral side of the artery, I have kept it at the center. Can you see one nerve? Actually, it is more easily seen in the ultrasound screen, but here it is showing a little smaller. Okay, but I think you can see it clearly. Let me freeze. So here it is the nerve. Everybody can appreciate here at this point. This is the median nerve. Clear? Again, I am showing once more the same pattern. The probe we are holding, we are changing nothing. Okay, sorry, escape, 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 escape. Okay, so we are going back and here, but one thing I should focus, because here at this point now, as I told, in the side there will be the pronator teres. So this is the junction between the, let me show you. Slightly coming down, and here you can see this is the junction between the pronator teres and the brachialis. So it is important to know this junction as well. Okay, because as I told, there are three muscles. So these are three muscles here. Now coming to the lower portion. Let us complete with the ulnar nerve, then go back to the lower portion. For the ulnar nerve, as I told, we have to first look at this bony portion. This is the medial epicondyle, and this is the olecranon process. We know in between there is the cubital tunnel. So it's very easy. Just try to bridge these two with the probe. So can you see? These are the two prominences, one here, another here. So let us try to bridge this gap. Okay. So which side is which one? Let's see. Left side of the screen, we can see the bony prominence, that is the medial epicondyle. So let us decrease the depth slightly, then it will be more easily visible. Okay. Okay. So now let me freeze. So in the left side, it is the medial epicondyle. In the right side, it is olecranon, another bony prominence, olecranon. And in between, we can see, as I told, here the nerve will be hypoechoic. We can see hypoechoic ulnar nerve. Clear? So if we need to block, usually block is done. If you are for anesthesia purpose, slightly proximal, and this place is ideal for the blocking for the pain management. Now let us come to the carpal tunnel. Yes. Can you see the arm? Okay. Now, slightly. Okay. Now it's clear. I'm showing first in between. Okay.
Was,
Here it is easy to locate. Okay.
am I audible to you? Devjyoti,
Yes.
was carpal
Yes.
tunnel we have covered already. So you show them superficial radial nerve, I think.
Carpal tunnel we have covered.
We already had a class.
Okay. We have covered. Fine. So median branch here we have covered in the forearm.
Forearm we have not covered.
Okay. Let's show in the forearm. Then I will go to the superficial branch. No, okay. So let us trace here. So usually what happens, as I told, in the lower portion, if we go to this portion, nerve becomes hypoechoic. As we move up, if you scan slightly here, it is more easy to find out the nerve. Just I have done nothing. Basically, I have put the probe here and we can clearly. We can see clearly the nerve which is looking popcorn like, okay, and which is in between the flexor digitorum superficialis and the flexor digitorum profundus muscle. So this is very clear, very easy. Basically, you just put it and you will be able to see. And in the same plane, if we go, we will be getting the ulnar nerve as well. So basically, they are in the same plane in the mean forearm. Okay, draw the so it is both the nerves are in between these two muscles, one in the medial side, median nerve, and the ulnar nerve in the lateral side. So it's very easy. Now the superficial branch comes at the level of the wrist. So as I have not, I think dorsal compartment is covered or not?
First compartment is there in the syllabus.
Okay.
Second compartment is not there in the basic course, but still I have shown them.
Okay, fine. So can you see one nerve bundle that is moving from the right side of the screen towards the left side? It's a very small nerve. Okay. So the nerve comes from above and then it crosses and it lies between the first and two. So this is the superficial branch. Now it is I am taking at the center, then it will be easy. Okay, for them to appreciate. So now we can see it is exactly at the center of the screen. Okay. So this one is the superficial branch of the radial nerve. So I think we have covered all the nerves, most of the important nerves we have covered, and we do not have much time. So any other questions?
Sir, can you please show the probe placement for the superficial branch of radial nerve?
Which one?
Superficial
Placement.
branch of
Okay, okay,
radial.
okay. So what we are doing, see, this is basically usually easily comes under the examination of the dorsal compartments. So to make it more easy, now just try to make the prominent of this anatomical snap box. Clear? So here it is the anatomical snap box. This side we are getting one compartment and here we are getting the another. And now show, this is in my mid prone position and we are just following above the tendon. Okay. And we'll be able to see, just move above and down, we'll be able to see the nervous structure which is coming from the I think we should say this is the this is ventral side to the dorsal side of the hand. So see, as we are moving up and down, we can see the small cutaneous branch which is coming from the medial side to the lateral side here. Okay, further reduction of the narcomania. This is the last one. Okay, so we'll be able to observe it moving from one side to the other. Okay. Okay. So let's be back. So any other questions? No questions. So let's finish for today.
And go with the X-ray part next from next week.
Okay. So we'll start the X-ray part from the next day. So goodbye for today.